Hello, my name is Dr. Christina O'Shaughnessy. I'm a board-certified plastic surgeon practicing at Female Plastic Surgery Associates of Tennessee. My practice is located in Franklin, Tennessee, which is just a few miles south of Nashville. I have been in practice now for over a decade, and I completed my residency training at Northwestern in Chicago, Illinois. I also did a dedicated breast fellowship at Nashville under Dr. Pat Maxwell in 2009. I specialize in both breast and body surgery, and I also like to do primary breast surgery as well as revision breast reconstruction and aesthetic surgery. So it can often be challenging for a woman to communicate both the look and feel that she desires. It's not as easy as them saying what cup size they want to be, and that's because there's no real standardization to cup sizes. Also, women have very different breast as well as chest anatomy, and that can also change the shape of the breast depending on the patient. I think the best way for a patient to communicate the look and feel they desire is to look at patient photo galleries. So oftentimes I will tell patients to look at the photo gallery I have, or they can go online and look at other board-certified plastic surgeon websites, and they can pick out a patient that looks similar to them. Oftentimes a plastic surgeon will try and categorize their pictures based on weight, height, and patients can often find somebody that looks very similar to them. So there's so much to cover during a breast consultation for augmentation, and that's because there are so many topics that I feel are important to cover. But if I had to narrow it down to 5 important topics, I would say the first would be concerning the safety of not only the breast augmentation procedure, but also the implants themselves. The second would be surrounding the complete surgical plan. So basically preparation as well as the actual surgical technique. So the implant size we choose, the style, the incision, as well as the placement of the device and recovery time. The third would be to discuss the complications or risks of breast augmentation, specifically rupture as well as capsular contracture. And then the fourth would be surveillance and how to monitor the breast implant. And the fifth, which I think is also very important, is to emphasize the expected follow-up in the office so that we can monitor patients' breasts over time. So cost can oftentimes be a barrier for patients undergoing breast augmentation, and many plastic surgeons offer different financing options to help patients be able to pay for this procedure and make it so that the financing fits their budget. In my office, we offer patient FI to reduce financial stress, and we tailor it based to the patient and based on their budget. We come up with monthly payments by completing a very simple online application that usually has very good turnover time and approval rates, as well as just soft credit checks. So in this way, patients are able to feel confident moving forward with choosing breast augmentation financially, and they're able to feel comfortable that it meets their budget. So oftentimes women will begin their search for a plastic surgeon by going to the internet and typing in searches, or by talking to their friends. I tell patients that it's very important that they find and seek out a board-certified plastic surgeon. They should go to their website, they should look at their pictures and their galleries to be sure that that surgeon specializes in breast surgery. Then when they go to their website and they can go see a different plastic surgeon, I definitely recommend seeing more than one plastic surgeon. I think it helps patients to make an informed choice, and I also think it helps patients to choose the right surgeon so they feel comfortable with their breast augmentation procedure.
Natrelle breast implants, important safety information and approved uses. Breast implants are not considered lifetime devices. The longer people have them, the greater the chances are that they will develop complications, some of which will require more surgery. Breast implants have been associated with the development of a cancer of the immune system called breast implant-associated anaplastic large cell lymphoma, BIA-ALCL. This cancer occurs more commonly in patients with textured breast implants than smooth implants. Although rates are not well defined, some patients have died from BIA-ALCL. Patients receiving breast implants have reported a variety of systemic symptoms such as joint pain, muscle aches, confusion, chronic fatigue, autoimmune diseases, and others. Individual patient risk for developing these symptoms has not been well established. Some patients report complete resolution of symptoms when the implants are removed without replacement. Who can get breast implants? Natrelle breast implants are approved for the following: breast augmentation for women at least 22 years old for silicone-filled implants, and for women at least 18 years old for saline-filled implants. Breast augmentation includes primary breast augmentation to increase the breast size and revision surgery to correct or improve the result of a primary breast augmentation. Breast reconstruction. This includes primary breast reconstruction to replace breast tissue, tissue that has been removed due to cancer or trauma, or that has failed to develop properly due to a severe breast abnormality. This also includes revision surgery to correct or improve the result of a primary breast reconstruction. Who should not get breast implants? Breast implant surgery should not be performed in women with active infection anywhere in their body, women with existing cancer or precancer of their breast who have not received adequate treatment for those conditions, women who are currently pregnant or nursing. What should I tell my doctor? Tell your doctor if you have any of the following conditions, as the risks of breast implant surgery may be higher. Autoimmune diseases, example lupus and scleroderma, a weakened immune system, example taking medications to decrease the body's immune response, planned chemotherapy or radiation therapy following breast implant placement, conditions or medications that interfere with wound healing and blood clotting, reduced blood supply to breast tissue, clinical diagnosis of depression or other mental health disorders, including body dysmorphic disorder and eating disorders. Those with diagnosis of depression or other mental health disorders should wait for resolution or stabilization of these conditions prior to undergoing breast implantation surgery. What else should I consider? There is a boxed warning for breast implants. Please see bold text at beginning. Many changes to your breasts following implantation are irreversible. If you later choose to have your implants removed and not replaced, you may experience dimpling, puckering, wrinkling, or other cosmetic changes, which may be permanent. Breast implantation is likely not a one-time surgery. The longer implants are in place, the greater the potential risk for complications. You will likely need additional surgeries on your breasts due to complications or unacceptable cosmetic results. Thus, you should also consider the complication rates for later revision surgery, since you may experience these risks in the future. Cancer treatments and surgery will affect the outcome and timing of breast reconstruction. Breast implants may affect your ability to breastfeed, either by reducing or eliminating milk production. Rupture of a silicone-filled breast implant is most often silent. Even if you have no symptoms, you should have your first ultrasound or MRI at 5 to 6 years after your initial implant surgery, and then every 2 to 3 years thereafter, regardless of whether your implants are for augmentation or reconstruction. If you have symptoms of or uncertain ultrasound results for breast implant rupture, an MRI is recommended. Additional imaging may be required depending on your medical history and status. The health consequences of a ruptured silicone gel-filled breast implant have not been fully established. Routine screening mammography for breast cancer will be more difficult, and implants may rupture during the procedure. Perform self-examination every month for cancer screening and ask your surgeon to help you distinguish the implant from your breast tissue. Lumps, persistent pain, swelling, hardening, or changes in implant shape should be reported to your surgeon and possibly evaluated with imaging. What are key complications with breast implants? Key complications include reoperation, implant removal with or without replacement, implant rupture with silicone-filled implants, implant deflation with saline-filled implants, and capsular contracture, severe scar tissue around the implant. Other complications include breast pain, swelling, asymmetry, wrinkling, rippling, implant malposition, nipple complications, hypertrophic scarring, and implant palpability visibility. Talk to your doctor about other complications. For more information, see the patient brochures at www.allergan.com/products. To report a problem with Natrelle breast implants, please call Allergan at 1-800-624-4261. The sale and distribution of Natrelle breast implants is restricted to licensed physicians who provide information to patients about the risks and benefits of breast implant surgery.